G'day, I just wanted to talk to you guys about a hip replacement or getting a hip replacement. I recently had one probably about 3 weeks ago now. And when I was looking online, there wasn't a whole lot of information about when you go, the day of the surgery and all that sort of stuff. So hopefully this helps a little bit. But on the day of it, as I said, I had my left hip done, and my leg was about an inch and a half shorter on the left side. So thankfully they managed to stretch it and get it damn near perfect. So that was really good. But the day of the surgery, I just sat down and they put the drip in me. I'm not real good with hospitals, like probably most people. So I was, very nervous and all that sort of stuff. But nurses were good, everything was good. So they put the drip in me, and I waited probably an hour and a bit. And then they came and got me, and they gave me some kind of I don't know what it was, some kind of relaxing drug to calm me down a little bit. And they wheeled me into the room where they put the spinal. So it's a really tiny needle that they put in my spine to numb me from the hips down. At that point, they could have chopped my arm off. I really was fine. I didn't care. I do remember being held up, and while they put the needle in, but I don't remember feeling it at all. It wasn't painful whatsoever. After that, they laid me back down. I was still talking, and the nurse gave me something, or the anaesthetist gave me something to put me to sleep. And I do remember sort of being picked up and put on the operating table, and that's it. And then I woke up. Absolutely no pain. I could not feel a thing from my hips down, which was a bit weird, but it wasn't bad. It didn't give me anxiety at all. It was fine. So they sat me in the bed and then waited until I felt my toes. I had to wiggle my toes, and it slowly started to come back. Sorry about the helicopter going over. And then slowly the feeling came back into my legs. Everything was good. And again, very little pain in the hip. I had an anterior one, which is the one in the front where they don't cut the muscle at all. They just move it to the side. So very little trauma at all. However, they did give me I had a bit of a bad reaction to whatever they gave me as far as painkillers. I'm not sure of the name, but it was the next one up from morphine. And I started to vomit and, I had a bit of a miserable afternoon. So I stayed overnight. But the actual hip surgery itself was nothing. And if you are contemplating getting it, don't get worried about it. I mean, obviously you're going to worry, but it is a very easy surgery. Probably I've had my deviated septum fixed, and it was just as easy as that. It was fine. My recovery has been a bit slower because of the stretch in the leg. So the muscles, obviously you can imagine the tendons and everything are pulled because of the discrepancy in the leg length. But the actual hip itself, zero pain. As soon as I woke up, fine, not a problem. You don't feel the steel that they put in your leg. You don't feel any of that at all. I didn't. I haven't felt a thing. It feels exactly like my right hip. There's no movement. It's not loose. I didn't have any aches or pains at all. My pain is obviously the swelling. You swell a little bit after the operation, which is obviously normal. And then the stretch, obviously the tendons and the muscle stretch, as I mentioned, was the worst thing for me. I was on crutches, or I was on the walker for 3 days, then crutches for about a week and a half, and then I had a cane for a couple of days. So it took me probably the better part of 3 weeks to get off it, and now I'm walking with a limp. However, again, if you don't have that leg discrepancy, I would say that after a week you're going to be fine. Again, all my pain is due to the stretch. The hip, if it was just a straight hip surgery, after a week I would have been absolutely fine. As far as painkillers, I hate taking them. I didn't take them at all. The first night, I think I just had Tylenol. That was it. So I'd take an aspirin in the morning and night for obviously the blood clot stuff that they give you. So aspirin was fine for me. And then Tylenol, probably the first week I would maybe take 2 or 4 a day. That was it, just depending on your activity. Ice was the key. They give you this. Well, my hospital gave me it's like an ice cube box thing that circulates water, and it's got a mat that you'll put on your hip. That thing is brilliant. I would suggest that you use that as much as possible. And you will need a recliner. I would say if you can get a recliner, that's going to help you a lot. So I just elevated my leg as much as possible and put the cooling stuff on it, and it was fine. The scar itself, the surgical site, I don't even think I'm going to have a scar. They married it up so well, and the cut was probably, I'd say, 3 to 4 inches, and that's it. And the stitches are all inside, so there's none of that. They'd give you a bandage. It's basically a big waterproof band-aid for the first 2 weeks. You don't have to touch it, don't have to do anything with it. You just have a shower as normal, and everything was fine. But I would honestly highly suggest, if you're thinking about it or you need it, don't hesitate to get it done. Again, I'm not a fan of hospitals like most people, but I would highly suggest that if you need it, get it done, because it's probably one of the best operations I've had, and probably the easiest operation I've had, as far as, speed and pain after it, all that sort of stuff. It's very quick. I hope this helps, and if you have any questions, just give me a comment on below, and I'll do my best to answer it. Thank you.